So much of the pandemic in the U.S. has played out as a tale of essentially two countries, with minority communities facing higher rates of both cases and deaths from COVID-19. And that disparity is also playing out over which Americans have access to testing to find out if they're at risk. With new data from ABC News and our partners at 538 showing that minority neighborhoods often have unequal access to testing sites compared to their white counterparts. ABC's Marcus Moore has a closer look at how this testing disparity is playing out in Texas and the doctors from New York trying to close the gap.
They are powerful images, massive lines stretching for miles at COVID testing sites from California to Florida and right here in Texas.
Es difícil encontrar un sitio de pruebas médicas.
Sí, batallamos porque cuando ya es como es por cita, ya no puede llegar uno más así, solamente por citas y sí batallamos.
Nearly 6 months into the pandemic, more than a dozen states face major testing problems, and concerning new research showing that the disparities minorities face are even worse. Our own ABC News 538 report analyzing test sites in all 50 states, finding locations are more scarce in many Black and Latino neighborhoods, communities that are already disproportionately affected by the virus. Dallas County Commissioner Dr. Elba Garcia says it's something she sees impacting minority communities here.
The Latino community have been heavily affected, primarily because we have the perfect storm of conditions, a high density, high number of essential workers, multi-generational families, and of course, a high immigration community, which means documented and undocumented. A lot of them feel threatened to go and look for healthcare or services that might challenge or in any way affect the opportunity for them to get a residency or a citizenship or a visa.
In Texas, residents in one Dallas zip code hit especially hard. A predominantly Latino community made of many essential workers now has more COVID cases than anywhere else in the county.
Zip code 75211 is a mainly predominantly Latino area with a lot of essential workers. These are the workers that, if they're not completely sick, they're the breadwinners. They're going to go to work. They're going to go and be sure that their family has the money they need to survive.
A narrative that is not exclusive to Dallas. 200 miles south in Houston, over the weekend, 15 of the 20 people who died from COVID-19 were Hispanic.
I thought it was just something that it was going to go away, that it wasn't that serious. And when it got to our family.
We spoke to Sonia Gomez, whose daughter Monica tested positive for COVID-19 2 weeks ago.
It was so scary for me. I just didn't know what to do.
How far did you have to drive to get a test?
We drove about 30 minutes, but I was so glad that they were able to get us in quickly because I had tried other places and the wait was about 3 to 4 weeks. And
wait, hold on, 3 to 4 weeks to get a test?
Yes. Because the free testing sites are very full right now. And they were able to, we got the appointment on Monday, so they were able to see us within this week.
What a difference.
Sonia tested positive for the virus after going to this testing site this weekend. And her husband is feeling symptoms but is still waiting on his results. That's further complicating going back to work at the front desk of a diagnostic center here in Houston, where she's been away for over a month.
And how has this pandemic impacted your work, your livelihood?
I have to stay home with my daughter since she got sick. I haven't been able to go to work for a month now.
And do we know at all how she may have gotten sick?
Yes, my sister that lives with my mom, she's a college student, so she's home from A&M. And she got it, but she gave it to my mom. And my mom is the one that babysits her when I'm at work, so that's how she got it. A lot of places that are not free, they're charging around 160, 180. It's a lot of money that we have to, pay. So we are very grateful that we have this type of sites.
But Houston is now getting some help from New York, returning the favor to communities that helped the city that was once the epicenter. A group of doctors and nurses volunteered to fly to Houston to set up free testing sites at 2 churches. The coordinator of the site, Dr. Yomares Peña, works with Somos, an immigrant-led network of doctors that partner with the state of New York to open bilingual sites.
So I think that if you go into medicine and in any field, either being a nurse, being a doctor, a practitioner in general, What calls you is vocation, what calls you is service. So it was just natural for us.
And that's why you're here. And I really get a sense of how personal this is.
So for me, this just becomes another mission where I'm helping my Hispanic, my Latinos, my African American family, my family in general, everyone that is underserved. These are the people that needs this type of testing sites. These are free. We speak your language, which we are fluent and culturally sensitive. You as a patient will identify with a physician or a nurse or someone that looks like you, that understands your needs and will come out for you. Then once they realize that we spoke their language, that whenever they come in, we'll say, hola, ¿cómo están? Bienvenidos. They will feel that they could come in and there was someone that it looks like them. Because if you think about the Hispanic communities or any underserved communities, how do people live? Multi-generationals in one same home, right? So if you have one positive, what's going to happen? The whole family might get infected.
Pena has been away from her family since the beginning of the pandemic, not taking a day off since March when New York City was hardest hit. To this group of frontline workers, it feels like a flashback.
What's been your hardest moment here throughout this whole ordeal?
I think the hardest thing was just to see the lack of people caring about social distancing and masks, and the divide in people not wanting to wear the mask or not wanting to social distance or people not believing in it. It's a serious matter that